You make my world a better place.
Yes!
We'll get you walking again soon.
That's good. I'm in the Cook Islands. Now, while this seems like the perfect place for a holiday, I've got a feeling this is going to be no vacation.
Chris has flown 5,000 kilometres to the exotic South Pacific, but he won't have time to enjoy the sights.
You see, there is only one vet clinic here, and they service an area of islands that's spread out over a patch of ocean bigger than the size of Australia. So I'm guessing they're going to need a hand.
Chris has headed straight to Rarotonga and the Esther Honey Foundation, which cares for the island's sick and injured animals.
I know.
The clinic was set up 30 years ago and relies entirely on donations and volunteers.
Hello? You the boss around here? Hello? Hello?
Hi.
How you going? I'm Chris.
Chris, Amy, nice to meet you.
Good to see you, Amy. Here to help.
That's spectacular.
You're excited about that?
I am always excited about more help. Since we do always have a full house at the Esther Honey Foundation, having extra sets of hands and extra help is always appreciated and takes a little bit of the burden off of us. Consultations happen in there.
Yeah.
Got our feeding and laundry in there. Over here, surgery and x-ray.
All right. I've only had a quick look around, but already I can see the conditions are pretty basic. There's one consultation room and very limited medication and equipment. Yet somehow, these guys are on the front line when it comes to helping out the sick and injured animals of the Cook Islands. I'll put my box down.
Yeah, do that.
We'll get started.
Sounds good.
Minutes later, the first emergency call comes in.
Got your gear?
Yep.
All right.
Let's go.
An animal has been found injured after a hit-run accident.
Looks like a puppy's been hit by a car, so we're just gonna go see what we can do to help that little dog out.
So this is pretty typical of what happens around here, I guess, with dogs not having fences and...
Yeah, it is pretty typical. It's also relatively typical that we need to go out and collect them because, as you're seeing now, most of the people just have motorbikes.
To be honest, as I'm arriving with Amy, I am expecting the worst. The cars on this road move quickly. So, the outcome surely can't be good.
Hi.
Hello there. How you going?
So what happened?
I was telling her to get up, but she lay there and her eyes were looking at me.
All right, so we'll just check her out now and just have a little look over her. Obviously, a lot of the pain is down the back part here, but we'll just start at the front. Even though Princess is moving around, the concern is always internal injuries. If she has something serious in there, like a bleed, she could have minutes to live. It's okay. I know.
Good girl, honey. Okay, so this dog's come in and she's not looking good at all. Hey, that feels really bloated.
At the Bondi Referral Hospital Sash, 6-year-old Molly has been rushed in with a badly swollen stomach.
When I feel her abdomen, it does feel bloated. She's really not in a stable condition, so we've got to act fast.
Emergency vet Dr Lisa Chimes is worried the listless greyhound has a dangerous condition called bloat.
Their stomach basically fills up with air and becomes massive. And the risk is that that stomach can twist, cutting off the blood supply to vital organs, and that can kill them. All right, honey, let's get an x-ray done.
Owner Bethany is a former vet nurse and recognised the symptoms straight away.
I've had a dog pass away with bloat about 10 years ago, and seeing Molly's symptoms, it kind of has given me a big scare, and I'm just hoping that what they find is not what I'm thinking, but I'm worried.
All right, come on, Molly. That's a girl.
I need to take an x-ray of Molly's abdomen right away because if she's got a bloated, twisted stomach, her life could be in serious jeopardy.
So she's just in a little bit of shock over what's happened. Just a little bit pale there.
In the Cook Islands, Chris has rushed to the aid of hit-run victim Princess.
So I just want to make sure that in the accident she hasn't done something to her lungs and just make sure her lungs are inflating properly. It looks like she's breathing fairly normally. Even though Princess has been up and has been moving around, the fact is she's not out of danger yet. The force that Princess must have been hit with had to be quite substantial. You can see she's whimpering when I move around her hip here. So that seems to be the sorest spot of all, is just up in the upper part of her leg. Isn't very comfortable for her. The obvious concern for me is that Princess has a really nasty fracture of either her femur or her pelvis. If either is the case, the consequences for her could be incredibly serious. I think the best thing to do is take her back to the vet clinic for an x-ray, and then from there the best thing we'll be able to do is work out exactly how severe her injuries are and what she needs from there. Okay. That sound all right with you?
Owner Mary and her niece Stephanie will be devastated if they lose their much-loved Princess.
I'll do anything just to keep her on her feet and make sure she's all right. As long as she comes back and she's fine, that's what matters the most.
Okay, so we'll talk to you soon. Yep. Okay, no problem. At the back of my mind throughout all of this has been the fact that the Cook Islands doesn't exactly overflow with orthopaedic surgeons or orthopaedic equipment. See you soon. If we do have quite a serious injury here, then I'm not sure exactly what we can do for it. Oh, where's the x-ray?
Yeah, x-ray's down here to the right. Take her right in.
Back at the Esther Honey Foundation, Chris and Amy are about to x-ray hit-run victim Princess.
Hey, it's okay, it's okay. It's okay, it's all right.
Chris is concerned the young pup may have sustained extensive injuries to her pelvis.
The force that Princess must have been hit with, it had to be huge. Her body can only sustain so much, so I'm expecting her injuries, unfortunately, to be substantial. She's a tough little thing, isn't she?
Yeah.
And hit by a car and then trying to run away.
Yeah, most island dogs are pretty tough. We do have quite a few three-legged dogs here in the Cook Islands, and that is mostly due to hit by car, road traffic accident. Because of the free wandering lifestyle that they have, they oftentimes cross the road, and sometimes they're smarter than other times. Sometimes they look, sometimes they don't.
Chris is hoping an injection of painkillers will help calm the distressed pup.
Here we go. You don't have to play the tough girl anymore. There's really no way of knowing what we're going to find in these x-rays. Most of Princess's pain is in the upper part of the leg, so obviously the focus has to be there. 1, 2, 3, go.
Okay.
Thank you.
All right. So you can take those up, get those developed. In the meantime, we'll put her in a cage so she can rest.
If we see quite severe damage on these x-rays, there is only so much we can do. With limited resources and limited equipment, orthopaedic surgery here is a very rare event. So, worst case scenario, she may need to lose that leg. Just take it easy, girl. I'll have those results for you soon.
We just need to get a picture of your tummy.
At Sash, 6-year-old Molly is about to have an x-ray. Lisa needs to confirm whether the greyhound has a potentially fatal condition called bloat.
I need to know if her stomach is twisted because if it is, she's going to need surgery straight away. All right, good girl. Stay there, Molly.
Molly's devoted owner is anxiously waiting for the results.
I'm hoping it's not bloat. I had a dog 10 years ago die because of bloat, which is really scary, and I just hope that she pulls through.
Oh no, this is bad. When I look at Molly's x-ray, her stomach is absolutely massive and it's very obvious that it's twisted. Now, that is something that needs surgery, and without it, Molly won't survive. So, I've taken an x-ray of Molly and it shows that she has got
a bloated and twisted stomach. So she needs emergency surgery.
Okay. Can I see her?
Absolutely. Come through.
My greatest fear is losing her, and that's not an option for me. I just want to make sure that she's okay, and I just can't lose her.
Molly's life-saving surgery needs to happen immediately.
You'll be good. You'll be good, okay?
It's absolutely heartbreaking just to think that she's about to go through major surgery and I just can't be there with her. My biggest fear at the moment is she doesn't come home. Oh, sorry.
So the human hospital's okay with 4-legged X-rays as opposed to 2?
Oh, absolutely, absolutely. They let us use their developer, and we just bring a disc and burn our radiographs on there, so we're not taking up any of their space.
It's a real community thing around here, isn't it?
Yeah, it really is. It really is.
In the Cook Islands, Chris is quickly realising how tough it is to care for the local animals.
This is it?
Yep.
He's just had to make an emergency dash to the nearby hospital, the only place with facilities to process Princess's X-rays.
The fact is, if we see a really, really bad fracture here, there's nothing even a human hospital could do for Princess on this island. Wow. Didn't expect that.
No.
She has just somehow taken a hit.
Moved on.
And moved on. The femur is very much intact, going into the head of the femur, into the pelvis. There's really
Looks really good.
no problems there at all.
No.
Which is quite remarkable. So we'll just have a look at the other view just to make sure. I mean, going from the knees right up to the pelvis here, she was whimpering when we touched those areas and flexed them.
Yeah.
But it looks like it's just all been soft tissue, just bruising really.
Yeah.
You do assume that just to survive around here, the dogs have to be, I guess, tougher than your average dog. And Princess, despite her name, is clearly no different. She somehow managed to, whilst crossing that road, see that car at the last minute, take the impact and walk away without any fractures. What do you reckon? Is she gonna be okay?
I think she's gonna be fine.
Yeah. Hey, you don't know how to look sore, do you? Come on. See you walk. You get up? Get up for us?
Oh, don't take off there.
There's not a lot of limping going on anymore.
Little,
Just a little one.
tender, but pretty good.
See you walk? Come on. Hey.
Princess's prognosis is actually a lot better than we thought when we first saw her. So bumps and bruises, nothing catastrophic, and she can go home with some pain medicine, rest, and recovery. Really lucky dog.
Oh. That's a catch.
Nice catch.
After all the panic of earlier, now it really comes to the nice part. I'm sure Mary and her daughter are sitting at home worrying about what's happened to Princess. We can give them the good news.
Good girl, Molly. All right, sleepy, sleepy girl.
At Sash, 6-year-old Molly is about to undergo an operation to try to fix her badly twisted stomach.
All right, let's get her up. Okay, Babs.
Having a twisted stomach is one of the most life-threatening conditions a dog can have, and if we don't operate on Molly, there is no way she'll survive.
Oh, no.
But suddenly, Molly's system begins to crash.
Her ECG is showing that her heart is racing. She's got a really dangerous arrhythmia, and if we don't treat it, that could kill her instantly.
Molly's abnormal heartbeat is a sign that her stomach is causing extreme pain.
We need to stabilise Molly and get her heart under control before we do anything else.
Although the surgery's gone well, there's still a small chance she could have serious problems, so she's going to have to recover in the ICU, where she'll be monitored closely for the next couple of days.
Hey, can you smell where you are? Yeah? Come here, come on. Got that one.
In the Cook Islands, it's time to reunite Little Hit Run survivor Princess with her owners.
What is it with you jumping? As I'm carrying Princess towards Mary and Stephanie, the look they give her is just one of absolute relief. They're overjoyed to see her again and just happy to have her home.
She's excited.
She's excited, yeah.
Hiya, princess.
So she's still a little sore, which is to be expected. And she's going to have a bit of bruising there for the next few days. But considering what she could have been facing,
Yeah.
it's a very, very good result.
I'm just grateful enough that you have saved her and brought her back and nothing has happened to her.
Well, you're beautiful people, and I can see how much she clearly means to you and how much you mean to her, considering that tail hasn't stopped wagging the whole time.
We are grateful to both of you.
It's great that the whole Esther Honey Foundation exists, isn't it? It's going to be hard to forget my first patient in the Cook Islands, but really she's demonstrated perfectly exactly the role these pets have in everyday life. They're part of the community, they're part of family, and they mean the world to these guys.
It's okay, sweetie. Good girl.
At Sash, Sonia from the animal rescue group Fetching Dogs has arrived with Rogue.
Just a little bit concerned about her right eye. So when we rescued her, she had some opaqueness to it, but now it's changed and it's gone red. We really need to investigate and get the eye fixed as quickly as possible so that she can go on and find a really wonderful, loving family, because she really deserves a great home.
Okay, so what brings Rogue here today?
We've just gotten her from the pound recently.
Yes.
And her right eye is, I don't know, it looks damaged.
Yeah, that doesn't look right at all. Wow. So it was like that when you got her?
Well, it was damaged, but it was like blue, and now it's gone red, so I'm just like, what's going on?
There are lots of different things that could be causing Rogue's eye problem. I need to run some tests to try and work out exactly what it is. So I'm just going to check the pressures in her eye.
Good girl, good girl.
All right, so that pressure's normal. She hasn't got a build-up of fluid behind the eye, which is glaucoma, so that's a good thing.
Yeah.
But it still is very, very unusual in such a young dog to have an eye like this. So I'm just going to examine the rest of her head too.
Yeah.
Have you noticed this lump on her cheek?
Where's that?
Just here, under that eye.
Oh, okay.
Yeah. Now, it concerns me a little bit that it might be related to the eye. And, and when any animal gets a lump, we need to make sure that it's not cancerous.
Yeah.
So what I'd like to do is I'll get our ophthalmologist to come and have a look at the eye, give me her opinion.
Okay.
Okay.
Yep, that's fine. Anything like the C word's always scary. So I'm a little bit worried about what that's going to turn up, and that's just a little scary.
Ophthalmologist Dr Alison Groth will be able to confirm if Rogue's eye can be saved.
Gosh, that's a very unhappy looking eye. So I'm just looking now at whether her pupils respond to light. They should become smaller when I shine a light in them, but she doesn't seem to have any vision at all in that right eye. It's likely that that eye will cause problems for her in the future, and that the best thing we can do for Rogue is actually to remove that eye.
Okay, so leaving it there is not going to work.
I'm concerned that it will become painful for her in the future.
Yeah.
Now we'll also look at taking that lump out as well, because we are really wanting to make sure that it's not cancerous and that the eye isn't cancerous either.
All right. Well, I guess it's got to come out.
It's a heartbreaking prognosis, but Sonia knows surgery will give Rogue the best chance at a happy future.
I was really hoping that we'd be able to keep the eye, but to save her any further pain, it has to come out. You be a good girl for Auntie Lisa, and I'll see you tomorrow, okay?
Rogue is such a beautiful puppy, and I really, really hope that we can get this eye problem sorted so that she can go to a brand new home. But if she's got cancer, well, that's going to make things very difficult.
The next patient's in a box with a food bag over the top. Around here, anything can happen.
At the Esther Honey Foundation in the Cook Islands, a mysterious patient is waiting to see Chris.
Hello.
Hello, Chris. Good.
Thanks for waiting in the waiting room.
That's all right, pleasure.
Go on through.
Okay.
I really want to know what's in here.
He's heavy. So I hope it doesn't flap all over the place.
Tell me what's in the box, please.
Muscovy duck, a large one.
Muscovy duck.
Yes.
Annette is worried about Manny, one of her pet ducks.
Oh, hello. You've been hiding in there, have you? Didn't expect to have a look in here and see you. No.
Manny seems friendly enough, but I'm seeing a big box and I'm seeing a lot of rope. Maybe I haven't quite seen the full Manny picture yet.
Very much so. Now you know why I closed the door.
Kind of making you look a bit foolish right now. Okay. So you're strong.
You never like to admit it, but this duck, he's got my measure. He's only small, but he packs one hell of a punch.
Hey, buddy, no, don't start that again. We've already seen you're a big, powerful man. You are. I believe you. You don't need to show it off. Okay, so this leg.
It's this leg, yeah.
All right. Is that his normal posture now, where he's leaning to one side?
When he stands up, he leans on one side. When he tries to walk, it's walking sideways. Yes.
Okay. So I'm just going to feel up from his hip joint right down to his knee and just see if we can work out where this problem's coming from.
Despite the show of bravado with Chris, it seems Manny isn't sticking up for himself at home.
My gut feeling is that Manny's damaged his leg in a fight with one of the other ducks. When male ducks fight, it can get really brutal, and often the weaker male walks away with some pretty serious injuries.
Okay, all the bones feel pretty intact there. He does have quite a bit of scar tissue running across the base of this leg here.
This is the strange thing. When I feel it, it feels pretty normal, but I do need to see how well he can walk, because if he can't, then he's facing some serious problems.
We're now walking the duck. Let's go. Come on. Go on. Okay, can you see where that foot goes? So he actually puts the foot out to the side.
Yeah.
And moves his right leg more underneath him. There's a definite limp there.
As soon as I put Manny on the ground, it's clear there is a problem. He really struggles to put any weight on that left leg whatsoever. So you can be sure he's in a lot of pain.
Can you imagine if you had busted your ankle, how you'd walk? So you use your right leg more. With this other one, you keep that foot as straight as possible. And it's exactly what he's doing. So it's something he's been dealing with for a while, but there's a reason why he's still got a problem after all this time.
Yeah.
I'll go inside and I'll tell you. I can't relax until I've caught him. Come here. Go on. Let's go. Let's go. See, I got you that time. Oh, almost.
Hey, Molly. How you doing, honey? Come on out.
At Sash, it's been 24 hours since Molly's life-saving surgery.
Molly came in here yesterday with a twisted stomach and she needed emergency surgery to have that stomach put back in position and have her spleen removed. I'm going to take a look at her and see how she's doing. A good girl, hey? Look really good. Most animals that have the same problem as Molly take a few days to recover, and Molly overnight is looking so much better. She hasn't had any complications, that arrhythmia has resolved, and I think she's ready to go home. Should we go see Mum? Okay, let's go.
I'm really excited to be able to take Molly home tonight. Normally they need to stay in hospital for a lot longer than this, but she's a fighter, my dog.
Hey, baby. Oh, my little. Hi. Hello. How are you?
I'm so relieved that Molly has pulled through. Knowing how severe this sort of situation can be, and the fact that she's pulled through is amazing. She's happy, she's bright, she looks incredible.
All right, so this is it.
Yay.
Bye, sweetheart. Hey, you be a good girl for Mum. Hey? Oh, you're a lucky thing.
When Bethany first brought Molly in here, she was absolutely devastated. She didn't even know if Molly was going to survive. And now she's taking her home and she must be over the moon. Bye.
Lisa, thank you.
Pleasure.
Come on.
I'm pretty confident his problem is down here. Right next to where he got me a beauty, by the way.
In the Cook Islands, Chris's feisty patient Manny has his own war wounds after fighting with other ducks.
So I think that he's actually got an infection in there. In the fight, it's introduced some bacteria underneath the skin here.
Right.
And it does actually feel quite hot there.
When ducks fight, they scratch, and when they do that, they inject bacteria with their claws underneath the skin.
So I think what we need to do is give him some anti-inflammatories and some antibiotics. If we do that, then we'll treat the cause of the problem, but also treat his symptoms. So he'll walk a lot better, but in the long term, we'll be able to fix the problem as well.
Okay. That's what we need. Yeah.
Yeah, it is.
I'm very glad Chris has treated Manny. I think with the antibiotics and anti-inflammatories, the duck will be a lot better and can probably fend for himself.
So I can give him his first dose now if you like. This is going to be tricky.
This is going to be tricky, real.
Manny will need to be on the prescribed medication for at least a few weeks. After this time, Chris is confident the young bird will make a full recovery.
I'm quite sure Manny's going to go home and tell all his mates how he beat up a vet from Bondi. And going on how I look right now, I don't blame him.
Oh, thanks, Chris.
No worries.
Lovely.
Good luck.
Later that day, Chris is making a house call to an unusual patient with a strange addiction.
Hello.
Oh, yeah. Hi, Chris.
How you going?
Hi.
Hey, nice
Erica.
to meet you.
Yeah, good to see you.
Now, a goat.
Yes. Okay. Well, she's over here.
But it seems Brownie the goat isn't keen to meet this Brownie from Bondi.
There was a goat.
There was a goat. I think she's eaten it. We're going to have to go and look for her.
Let's have a look.
Okay. Okay.
This may be the most unique goat anywhere in the world because right now it's invisible. It's nowhere to be seen. So not her?
She's got a pink collar on this morning. I put one on her.
Okay. Brownie!
Brownie was close to death when Erica first found her. The tiny goat was severely malnourished, and the only thing Erica could convince her to eat was Turkish bread.
Unfortunately now, she's really obsessed with eating Turkish bread.
So we've got a bread addiction.
Yes, we have. Got a serious one, I'm afraid.
But no goat to go with it.
No goat yet. I think in the beginning, because she wasn't eating anything at all, it was the best I could do.
Brownie!
It was really, really bad. Just skin stretched over bone. That's all she was.
Brownie!
What concerns me now is that Brownie is a healthy goat and doesn't need to eat Turkish bread.
It's in those low trees. An addiction to eating Turkish bread, it may sound almost funny, but it can have quite fatal consequences. Goats running everywhere. My worry is that eating more than just, say, a slice of Turkish bread could cause a condition called lactic acidosis. It's also called grain poisoning, and in a lot of animals, it can be fatal.
Brownie!
That's her?
Come on, darling.
Finally, Brownie decides to come out of hiding.
Darling, I know there's strangers here. Come on, sweetheart.
Brownie, we've been looking for you.
Come on.
No bread, but...
Yeah,
No
stranger
bread, no
danger.
interest.
Stranger danger. Come on, you better follow me. Come
Blends
on.
in. Okay, let's go.
Come on, darling.
Brownie is now being taken to Erica's house so Chris can see firsthand how this little goat is managing to feed her deadly addiction.
Brownie has definitely become a part of my life. I couldn't live without her. The thought that it could kill her defeats the whole object. And that would be dreadful. Really would. Come on, sweetheart.
Let's go.
It will be a nervous wait until then.
All right, that's it. Done.
And I'm really happy with how it went. She's been a very good patient.
Let's go. Let's go, Brownie.
So this is where it all happens.
This is where it happens.
In the Cook Islands, Erica is hoping Chris can stop Brownie's deadly Turkish bred addiction.
Turkish bread seems benign enough, but what it is a really rich source of carbohydrates. And normally animals like goats eat grass, something that takes a lot of work to digest. All the energy in it, all the carbohydrate is very readily absorbed. The bacteria in their gut starts to process it, and suddenly they multiply because there's so much food. All those bacteria then cause a whole burst of acid to be released into the system, and that acid can kill the goat. Can I see what happens?
A breakfast session?
Yeah.
I've got 10 cats, and they have to all be fed in different places.
You've got quite an audience here.
Well, this lot, yeah.
3 cats and a goat
So far.
watching your every move.
She knows where my concentration's gone. She knows she's not supposed to steal out of the fridge where the Turkish bread is, but she waits for her moment. She's at this fridge already.
So she's seizing her moment there.
Totally. If I say to her, out of the fridge, and I close it, she knows that as soon as it's closed, if she gets there immediately, she can still pull it open.
So she gets her head in there and then steals it. The challenge is going to be making sure she stays out of that fridge, because you should still be able to have Turkish bread yourself.
I need to get in the bread. Yeah, exactly. I like Turkish bread too, believe it or not. Yeah.
And you shouldn't have to buy a new fridge, so
Yeah.
I'll leave that with you.
Okay.
And you leave this problem with me.
Brownie, you're just going to have to behave yourself. Brownie's very determined, so I'll be very interested to see what he comes up with. Oh, no. Come on, Brownie.
Hey, Rogue. How you going?
At Sash, it's been 24 hours since Rogue underwent surgery to remove her eye and the dangerous lump growing underneath it.
Rogue's recovered well from the surgery. She's looking fantastic. She's wagging her tail and she's definitely ready to go home. Should we go see Sonia? Hey? Should we go?
Foster mum Sonia is eagerly waiting for the brave rescue dog.
I've got 4 other dogs at home. They were all looking for her when I got home, so they were all a little bit down last night, and so was I. I was just hoping that she came through the surgery really well and, you know, she wasn't missing us.
Hey, where's Sonia? Where's Sonia? In there. Hello. Hey, you gorgeous. Oh, look at you. Oh, yes. Yes. She's so excited to see you. Oh. Yes. So where the eye was is quite swollen now, and also where the lump was taken out, so that will settle down over the next week. Her hair will grow back over the area and no one will even notice.
Okay.
Okay.
And you're still just gorgeous anyway, aren't you, darling?
Just as happy as she was before, so.
I'm hoping for Rogue now that obviously she heals up really well, she doesn't have any pain, any complications, and she'll find a really wonderful home.
We'll miss you, sweetie pie. You've been a delight to look after. Rogue is so happy to be going home with Sonia. She's wagging her tail. Now we need to just wait for the pathology results, and I'm really, really hoping that it doesn't come back as cancer.
Come on, let's go.
This is more like goat food.
In the Cook Islands, Chris is on the search for a cure for Brownie the goat's dangerous Turkish bred addiction.
And it's right there. It'll work. The way I see it, it's been Brownie's sense of taste that's got her into this mess. Hopefully it'll be her sense of smell that gets her out of it.
You gonna be a good girl?
Erica knows that if this Turkish bred obsession isn't stopped, she risks losing her best buddy.
I feel dreadful that it could actually kill her. She needs to return to being a goat. Although we'll still love her, that's got to stop now.
Brownie, I had to say it, from one Brownie to another. The game is up, my friend.
Come on, Browns.
It's time to fix this problem once and for all. Now, I considered putting a lock on the fridge.
Yeah.
Even a latch.
Okay.
That's going to be annoying for you because you can't just walk over, open the fridge, get things out.
Exactly.
And I know when you're feeding all those cats, it's absolute mayhem.
Yeah, yeah.
So I'm going to use something that takes away any interest Brownie has in opening the fridge in the first place.
Okay.
You ready for it?
Yeah.
It's a vapor rub.
Oh, she won't like the smell of that.
Exactly. So all we need to do is just get a fingerful.
Right.
And we just smear it at her height along the fridge door.
That's not so nice, is it, Brownie?
And now, I guarantee you,
she's not going to go there.
She's no longer interested in that fridge. We'll shake it there.
It doesn't like it. I'm actually blown away. I mean, vapor rub, who would have thought of that? This is so simple, this answer. I don't know why it hasn't been thought of before.
The big test is, with the door just sitting there and the bread is inside.
She's going to try and open the door now from the other side because that smells of eucalyptus. So she's hoping that the fridge is going to open this way.
Bit of goat optimism.
Yeah.
Yeah.
Well, I think, and she's going to work on that.
Anything's worth a go.
Yeah.
This will obviously stop her eating the bread and you'll have amazingly clear sinuses for months.
Yeah, it'd be great. Thank you. Fantastic.
Right.
And she won't get any colds. Thank you.
No worries at all.
Thanks so much.
Okay, take care.
All right. Bye.
See you soon. Oh, really? That's what you think?
Oh, no. Come on, Brownie. That is not gone. No, 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 no.
Always have to have the last laugh, don't you?
Come on, Brownie. That is not on. You know you're not allowed to do that in the house. Come on. I have to go and get a towel. Excuse me.
Cook Island's full of surprises.
We're going to meet your new family. Yeah? Come on.
It's been 4 weeks since Rogue's operation, and foster carer Sonia has now found the brave wolfhound a brand new home.
Rogue's come along today to meet Amy, Ruth and little Theo. They're a lovely family, so fingers crossed this is the home for her. Say hello.
Rogue.
I'm Rogue.
Hello, Rogue. Oh, she's so beautiful.
Look. Hey, Theo, look.
So gorgeous.
Look. Do you think their tummy rubs are good enough?
Oh, good girl.
You like them, darling? Hey?
Oh, Rogue's beautiful. The minute I seen her, I just sort of fell in love, and yeah, she's definitely special.
Theo. Oh, look. Oh, oh.
And there's even more good news.
Rogue's lump came back non-cancerous, so that was very relieving. So everything's all good.
Go. The fact that Rogue's only got one eye doesn't seem to bother her at all. She's just getting around normally and will lead a happy life. Come on, Rogue. Good girl. Good girl. Come on.
Hi, I'm Dr Danny Dusek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell and we'll see you on our next video.